breathe deeply, feeling your body relax. Today we discuss caring for your skin after pimple extraction, how to support healing and prevent scarring after a blemish has been drained. Sometimes, despite our best intentions not to touch breakouts, a pimple comes to a head and needs to be drained, or you've had professional extraction. Proper aftercare is crucial for healing without infection, inflammation, or scarring. First, understand what happens when a pimple is extracted. Whether open naturally or manually, extraction creates a small wound. The protective skin barrier is breached, leaving the area vulnerable to infection and inflammation. Your immediate care in the hours and days following extraction significantly affects healing outcomes. Immediately after extraction, the priority is cleanliness and protection. If you've just extracted a pimple at home, immediately cleanse your hands and the affected area with gentle cleanser and lukewarm water. Pat dry very gently with a clean towel or tissue. Apply an antibacterial spot treatment. Benzoyl peroxide at 2.5% kills bacteria that could infect the open pore. Alternatively, use a spot treatment with salicylic acid or a dab of antibiotic ointment. Apply carefully just to the extracted area. Consider applying a hydrocolloid bandage or acne patch over the extracted pimple. These serve multiple purposes. They protect the wound from touching and bacteria, absorb any remaining fluid, create a moist, healing environment that reduces scarring risk, and prevent you from touching the area again. Leave the hydrocolloid patch on for several hours or overnight. When you remove it, you'll often see that it's absorbed additional fluid, continuing the clearing process. For the first 24 to 48 hours after extraction, be extremely gentle with the area. Don't apply makeup over it if possible. Don't touch it. Don't pick at any scab that forms. Scabs are your skin's natural bandage, and removing them increases scarring risk. Cleanse your face gently once daily, being extra careful around the extracted area. Use your regular gentle cleanser with fingertips only. Pat dry carefully. Continue applying spot treatment and/or hydrocolloid patches until the area has closed and begun healing. This typically takes 2 to 5 days depending on the size and depth of the original pimple. Once the wound has closed, usually after a few days, you can begin supporting healing and preventing scarring. Keep the area well moisturized. Hydrated skin heals better and faster than dry skin. Apply your regular moisturizer over the healing area. Protect the area from sun exposure vigilantly. UV radiation can darken healing skin, creating post-inflammatory hyperpigmentation that lasts for months. Apply sunscreen carefully over the area every day. Consider using a zinc oxide-based spot treatment that provides both sun protection and healing support. After a week or so, when the area has healed over but may still be red or dark, you can begin using ingredients that support scar prevention and fade any darkening. Vitamin C serum helps brighten post-inflammatory marks and supports collagen production. Apply carefully to the healing area once or twice daily. Niacinamide reduces inflammation and helps prevent excess pigmentation. A serum or moisturizer with 5% niacinamide can be applied to the healing area twice daily. Once the area is fully healed with intact skin, usually after 1 to 2 weeks, you can carefully use gentle exfoliants to help fade any remaining mark. AHAs like glycolic acid at 5 to 8% concentration used 2 to 3 times weekly help remove pigmented surface cells. Retinoids support cell turnover and collagen production, helping heal marks faster. Wait until the area is completely healed before applying retinoids, then use them carefully 2 to 4 times weekly. What not to do after extraction. Don't pick at scabs or peeling skin. This dramatically increases scarring risk and can reintroduce infection. Don't apply harsh treatments hoping to speed healing. Aggressive products cause more inflammation and delay healing. Don't cover with heavy, pore-clogging makeup immediately. If you must cover it, use light, non-comedogenic mineral makeup and remove it thoroughly in the evening. Don't expose healing skin to sun without protection. This causes darkening that can last for months. Don't extract the same area again if it refills. Some pimples require multiple drainage sessions, but wait until it clearly comes to a head again and consider professional help for persistent cystic lesions. For professional extractions, follow your esthetician's or dermatologist's specific aftercare instructions. They may recommend specific products or treatments based on your skin and the type of extraction performed. If you notice signs of infection, increasing pain, warmth, spreading redness, pus, or fever, contact a healthcare provider immediately. Infected extraction sites need medical treatment. Prevention is always better than aftercare. The best way to avoid needing post-extraction care is to avoid extraction altogether through prevention and gentle treatment of acne. But when extraction has occurred, proper care minimizes complications. Going forward, learn from this experience. If certain behaviors led to the extraction, picking, using harsh products, neglecting your routine, recommit to gentler practices. If the pimple was unavoidable and extraction was necessary, know that with proper aftercare, your skin will heal completely. Be patient with healing. The initial wound closes within days, but complete healing, including fading of any redness or dark marks, takes weeks to months. This is normal. Continue your gentle care consistently. Monitor the healing process. If a mark persists for many months without fading, if a scar develops, or if you're concerned about healing, consult a dermatologist. Professional treatments like chemical peels, microneedling, or laser can address persistent marks or scars. As we close, remember that extraction creates a wound requiring gentle care for proper healing. Cleanliness, protection, patience, and sun protection support healing without scarring. May your skin heal quickly and completely. May you resist further picking. May you learn gentler ways to care for breakouts going forward. Thank you for this time together. Care for your extracted pimple sites gently and patiently.
And lifestyle optimization become increasingly important during menopause. Pregnancy acne occurs in some pregnant women due to hormonal changes. Treatment options are limited during pregnancy because many acne medications are contraindicated. Isotretinoin is absolutely contraindicated due to severe teratogenic effects. Retinoids are generally avoided. Oral antibiotics like doxycycline are contraindicated. Spironolactone is contraindicated due to potential effects on male fetus development. Safe treatment options during pregnancy include topical benzoyl peroxide, topical azelaic acid, topical salicylic acid, though large-scale systemic absorption is theoretically possible with large area application, and it's best used sparingly, and possibly topical clindamycin. Most women manage pregnancy acne with these limited options, prioritizing safety. Some pregnant women actually experience improvement in acne due to pregnancy hormonal changes, while others experience worsening. Postpartum acne sometimes occurs as hormones shift again after delivery. This usually resolves within several months, though if breastfeeding is occurring, some hormonal factors may persist. Standard acne treatments are generally safe while breastfeeding, though some medications require careful consideration. Discuss specific medications with your healthcare provider if treating acne while breastfeeding. Age-related changes in acne treatment tolerance are important. Adolescent skin is generally very resilient and tolerates aggressive treatment well. Aging skin becomes more sensitive and drier, requiring gentler treatments and more aggressive moisturizing even if using the same medications. An adolescent might tolerate 2% salicylic acid daily with minimal dryness, while a 45-year-old woman with the same treatment might experience excessive dryness and irritation, necessitating reduced frequency or concentration. Transitional acne between life stages sometimes occurs. A teenager transitioning to adulthood might experience changing acne patterns. An adult woman starting hormonal contraceptive might initially experience worsening acne before improvement. A woman entering perimenopause might experience acne worsening despite previous successful acne control. These transitions require reassessment and potential treatment adjustments. Psychological impact varies with age. Adolescent acne causes significant psychological distress due to developmental sensitivity about appearance and peer dynamics. Adult acne can cause depression and anxiety, particularly if unexpected after years of clear skin. Menopausal acne can be particularly frustrating as women are simultaneously managing other menopausal symptoms. Acknowledging the psychological impact and treating acne aggressively for mental health reasons is justified. Understanding your life stage allows you to set appropriate expectations and select appropriate treatments. Adolescents should prevent lifelong acne through good habits. Adults should identify contributing factors, stress, hormones, products, specific to their life circumstances. Menopausal women should recognize acne as a normal menopausal symptom and pursue appropriate treatment. Pregnant women should prioritize safety while still treating acne to maintain mental health. Postpartum women should understand that acne often resolves as hormones stabilize. Guide 26. Post-acne skin barrier repair and restoration after aggressive treatment. After intensive acne treatment, your skin barrier often requires dedicated repair and restoration. Understanding skin barrier function, signs of barrier compromise, and recovery strategies is essential for returning to healthy, resilient skin after aggressive treatment phases. Your skin barrier, also called the stratum corneum, consists of dead skin cells, corneocytes, bound together by lipids, creating a protective wall that prevents water loss and keeps irritants and pathogens out. When functioning optimally, your barrier is resilient, hydrated, and protective. When compromised by aggressive acne treatment, the barrier becomes thin, allows excessive water loss, and becomes reactive to previously tolerated products and environmental factors. Signs of barrier compromise include tightness and discomfort, increased dryness and flaking despite using moisturizer, redness or inflammation without active acne, stinging or burning when applying products previously tolerated, increased sensitivity to temperature extremes, and heightened reactivity to skincare products, developing reactions to products that previously seemed fine. Several factors compromise the skin barrier during acne treatment. Multiple chemical exfoliants, salicylic acid, glycolic acid, used simultaneously strip away protective lipids excessively. Retinoids, while beneficial, can compromise the barrier during the initial adaptation phase. Benzoyl peroxide can be somewhat drying. Hot water and harsh cleansing compromise the barrier. Excessive sun exposure damages barrier function. The cumulative effect of multiple treatments or very aggressive single treatments overwhelms the barrier's ability to maintain function. Barrier repair requires specific approaches different from standard acne skin care. The goal shifts from treating acne to restoring skin health. This recovery phase typically lasts 2 to 4 weeks but can take longer with severe barrier compromise. The first step in barrier repair is stopping all unnecessary irritants. This means discontinuing strong actives temporarily. Stop salicylic acid, benzoyl peroxide, and retinoids. Stop chemical exfoliants. Stop high-concentration vitamin C or other potentially irritating ingredients. Use only gentle, basic skin care during the recovery phase. Gentle cleansing becomes paramount. Use only lukewarm or cool water with a very gentle, minimal cleanser or even just water cleansing. Avoid all manipulation or massage of the skin. Pat dry gently, don't rub. Minimize cleansing time, wash quickly and gently rather than scrubbing or massaging. Lipid-rich moisturizing is essential. Your barrier needs ceramides, cholesterol, and fatty acids. Moisturizers containing these lipids support barrier repair. Apply moisturizer to slightly damp skin immediately after cleansing to lock in hydration. Use generous amounts, don't skimp on moisturizer during barrier repair. Many people find that using moisturizer 3 to 4 times daily during barrier repair accelerates recovery compared to twice daily application. Humectant-rich products maintain skin hydration. Ingredients like hyaluronic acid, glycerin, and squalane draw water into the skin, supporting hydration during barrier repair. Many hydrating serums or essences contain these ingredients. Apply these before your moisturizer to layer hydration. Some people benefit from occlusive products during barrier repair. An occlusive final layer locks moisture into skin. Facial oils, jojoba, squalane, or balms create an occlusive layer over your moisturizer. This is particularly helpful at night when you're not exposed to environmental stressors. Centella asiatica, SACA, is a botanical ingredient that supports skin barrier repair through multiple mechanisms. It strengthens the barrier, reduces inflammation, and promotes skin resilience. Many products now contain SACA for its barrier-supportive properties. Using a SACA-containing product during barrier repair can accelerate recovery. Avoid all environmental stressors during barrier repair. Don't expose skin to extreme temperatures, hot showers, very cold weather. Use a humidifier to maintain ambient humidity, as dry air worsens barrier compromise. Avoid air conditioning when possible, it's drying, or use a humidifier to counteract its effects. Protect skin from sun exposure. Wear sun protection even though you're not using UV sensitizing treatments. Avoid actives and potential irritants completely during barrier repair. This means no vitamin C, no niacinamide in high concentrations, no peptides, no strong antioxidants. Even gentle ingredients might irritate severely compromised skin. Stick to cleanse, hydrate, moisturize, protect as your only routine. Timeline for barrier recovery typically takes 2 to 4 weeks. By week 1, you should notice reduced tightness and reactivity. By week 2, increased tolerance and reduced dryness. By week 3 to 4, most barrier compromise resolves. However, severely compromised barriers might take 6 to 8 weeks for complete recovery. During barrier recovery, you can still protect your skin from future acne. Using SPF 30+ sunscreen is essential and doesn't compromise recovery. In fact, it supports it by protecting your recovering skin. Sunscreen should be your only active product during this phase. Once your barrier has recovered, you're comfortable, no longer experiencing tightness or reactivity, and your skin feels resilient again, you can gradually reintroduce active treatments. However, do so carefully and at lower concentrations and frequencies than you used before. For example, if you were using 2% salicylic acid daily before barrier compromise, restart with 0.5% salicylic acid 2 to 3 times weekly. Build up slowly. Reintroduce treatments one at a time, waiting at least 1 to 2 weeks between introducing new actives. For example, reintroduce salicylic acid first, wait 2 weeks to ensure tolerance, then introduce benzoyl peroxide if desired. This sequential approach prevents recompromising your barrier. The barrier repair phase teaches valuable lessons about acne treatment. It emphasizes that more aggressive treatment isn't always better. Often, moderate treatment applied consistently yields better long-term results than aggressive treatment causing barrier compromise requiring recovery phases. Maintaining a healthy barrier improves overall skin health and can actually improve acne outcomes by supporting skin function. Some people find that once their barrier recovers, they can maintain clear skin with gentler treatment than they used before barrier compromise. For example, someone might have needed 2% salicylic acid daily and benzoyl peroxide to control acne, but after barrier recovery and switching to gentler 0.5 to 1% salicylic acid with retin.
Welcome to this peaceful, supportive space. Take a deep breath in, feeling your body relax completely. Exhale slowly, releasing any worry or tension. Today we're going to talk about something that affects so many people with such tenderness and care. How to reduce acne gently and safely without harsh treatments or aggressive approaches that can damage your skin. If you're dealing with acne, first know this: you are not alone, you are not doing anything wrong, and your skin is not broken or bad. Acne is an incredibly common skin condition that affects people of all ages. It's not a reflection of your hygiene, your worth, or your self-care efforts. It's a complex condition influenced by hormones, genetics, environment, and many factors beyond your control. The gentle approach to acne is about working with your skin, not against it. It's about supporting your skin's natural healing processes rather than attacking the acne with harsh, stripping treatments that often make things worse in the long run. Let's explore how to care for acne-prone skin with compassion and effectiveness. First, let's understand what acne actually is. Acne occurs when hair follicles become clogged with oil and dead skin cells. This creates an environment where bacteria can multiply, leading to inflammation and the formation of pimples, blackheads, or cysts. Various factors contribute. Hormonal fluctuations, stress, certain medications, diet, and genetics all play roles. Understanding this helps you approach acne treatment rationally rather than emotionally. Your skin isn't misbehaving. It's responding to internal and external factors. Your job is to support it in clearing those clogged pores and reducing inflammation, gently and consistently. The foundation of gentle acne care is proper cleansing without over-cleansing. This balance is crucial. You need to remove excess oil, dead skin cells, and bacteria. But you don't want to strip your skin so harshly that you damage your barrier and trigger more oil production. Use a gentle pH balance cleanser formulated for acne-prone skin. Look for cleansers with salicylic acid or benzoyl peroxide, but in low concentrations, 2% salicylic acid or 2.5% benzoyl peroxide are effective, yet gentle. These ingredients help unclog pores and reduce bacteria without being overly harsh. Cleanse once in the evening to remove the day's accumulation. In the morning, many acne-prone skins can simply rinse with water. Over-cleansing, even with gentle products, can backfire by irritating your skin and triggering more oil production. When you cleanse, use lukewarm water and gentle circular motions with your fingertips. Don't scrub, pick, or use harsh tools. Treat your skin with tenderness, even though you might feel frustrated with it. Aggression toward your acne only creates more inflammation. After cleansing, the next step is treatment. Gentle acne treatment uses proven ingredients at appropriate concentrations, applied consistently but not aggressively. Salicylic acid is a beta-hydroxy acid, BHA, that penetrates into pores, dissolving the oil in dead skin cells that cause clogs. It's oil-soluble, making it particularly effective for acne. Use products with 0.5 to 2% salicylic acid. You don't need higher concentrations. They're more likely to irritate without being more effective. Start by using salicylic acid every other evening. Apply it after cleansing on dry skin, then wait a few minutes before applying moisturizer. As your skin builds tolerance, you can increase to nightly use if needed. But many people find every other night use sufficient and less irritating. Benzoyl peroxide is another effective acne treatment. It kills acne-causing bacteria and helps unclog pores. Use 5% concentration. Research shows it's just as effective as higher concentrations, but much less irritating. Apply it as a spot treatment or thin layer over acne-prone areas after cleansing. Be aware that benzoyl peroxide can bleach fabrics, so use white towels and pillowcases, or let it fully absorb before your face touches fabric. Some people use both salicylic acid and benzoyl peroxide, but not at the same time. You might use salicylic acid in the morning and benzoyl peroxide at night, or alternate them on different nights. Listen to your skin. If it becomes irritated, scale back to using just one. Niacinamide is a gentler option that supports acne treatment beautifully. It reduces inflammation, regulates oil production, and strengthens your skin barrier. A serum or moisturizer with 5% niacinamide can be used daily and work synergistically with other acne treatments. Retinoids, including over-the-counter adapalene or prescription tretinoin, are highly effective for acne. They increase cell turnover, preventing dead skin cells from clogging pores. However, they can be irritating, especially initially. If you use a retinoid, start with the lowest concentration, apply it only 2 to 3 times per week at first, and always use it with adequate moisturization. Retinoids are a long-term strategy. They take several months to show full effects. Now let's discuss moisturizing for acne-prone skin. This is crucial and often overlooked. Many people with acne skip moisturizer, fearing it will make them more oily or cause more breakouts. This is a mistake. Your skin needs hydration, even oily acne-prone skin. When your skin is dehydrated, it produces more oil to compensate, potentially worsening acne. When your skin barrier is compromised by harsh treatments, it becomes more vulnerable to irritation and infection. Moisturizer addresses both issues. Choose a lightweight, oil-free, non-comedogenic moisturizer. Gel or gel cream formulas often work well. Look for ingredients like hyaluronic acid for hydration, niacinamide for oil regulation and calming, and ceramides for barrier support. Apply moisturizer after your treatment products have absorbed. Don't skip this step, even if your skin feels oily. Proper hydration actually helps regulate oil production over time. Sun protection is absolutely essential when treating acne. Many acne treatments, particularly retinoids and acids, make your skin more sensitive to sun. UV exposure can also darken post-acne marks, making them take longer to fade. Use a non-comedogenic, oil-free sunscreen daily. Mineral sunscreens with zinc oxide work well for many acne-prone skins, as zinc has mild anti-inflammatory properties. Let's talk about what not to do when dealing with acne. Don't pick, squeeze, or pop pimples. This is perhaps the hardest advice to follow, but it's crucial. Picking spreads bacteria, causes inflammation, damages your skin, and leads to scarring. If you have a pimple that's ready to drain, do so with clean hands and gentle pressure only, then immediately apply a spot treatment. But mostly, hands off. Don't over-exfoliate. It's tempting to scrub away acne, but physical exfoliation can spread bacteria and irritate inflamed skin. Chemical exfoliation with salicylic acid is gentler and more effective. Limit exfoliation to 2 to 3 times per week at most. Don't use multiple harsh treatments simultaneously. Layering several strong acne products causes irritation, damages your barrier, and often makes acne worse. Choose 1 or 2 treatments and use them consistently but gently. Don't expect instant results. Acne treatment requires patience. Most treatments take 6 to 12 weeks to show significant improvement. This slow timeline is frustrating but normal. Consistency matters more than intensity. Let's discuss lifestyle factors that support gentle acne treatment. Clean pillowcases and towels prevent reinfecting your skin with bacteria. Change your pillowcase at least twice weekly, more often during active breakouts. Use a clean towel to dry your face, or dedicate a small towel just for your face that you wash frequently. Avoid touching your face throughout the day. Your hands carry oil, bacteria, and dirt that transfer to your skin. Every unnecessary touch can introduce new problems. Manage stress, as stress hormones trigger inflammation and can worsen acne. Whatever helps you decompress, exercise, meditation, creative pursuits, time with loved ones, is indirectly treating your acne. Stay hydrated and eat a balanced diet. While diet's role in acne is complex and individual, generally nutritious eating supports your skin health. Some people find that dairy or high glycemic foods worsen their acne. If you suspect this, try eliminating them for a month and observe. Get adequate sleep. Your skin repairs itself during sleep, and chronic sleep deprivation increases inflammation and stress hormones, potentially worsening acne. Now let's address emotional care while dealing with acne. Acne affects mental health and self-esteem significantly. Be gentle with yourself emotionally as well as... Welcome to this soothing moment of care. Breathe gently, allowing calm to fill you. Today we discuss calming irritated or reactive skin, how to care for skin that feels easily bothered, red, or uncomfortable with the utmost gentleness and understanding. Irritated or reactive skin can feel frustrating and uncomfortable. Your skin might sting when you apply products, become red easily, feel tight or itchy, or react to things that never bothered it before. This reactivity often signals a compromised skin barrier or increased sensitivity, and it needs gentle, thoughtful care. First, understand that reactive skin is often a temporary condition that can improve, not necessarily a permanent skin type. Many factors can cause skin to become reactive: overexfoliation, harsh products, environmental stress, allergic reactions, hormonal changes, stress, or illness. Identifying and removing triggers while supporting your barrier can restore your skin's resilience. The immediate priority when your skin is irritated is to simplify drastically and remove all potential irritants. Strip your routine down to bare essentials: a very gentle cleanser, a bland moisturizer, and sunscreen. Everything else must stop temporarily. Remove all active ingredients. Stop retinoids, acids, vitamin C, and any other treatment products. These are too stimulating for irritated skin right now. You'll reintroduce them later, one at a time, once your skin has calmed. Stop all exfoliation, whether physical or chemical. Your skin cannot rebuild its protective barrier while you're removing layers. No scrubs, no acids, no exfoliating tools. Discontinue any products with fragrance, essential oils, alcohol, or other known irritants. Even natural ingredients can irritate compromised skin. Choose fragrance-free, minimal ingredient products. For cleansing, use an extremely gentle, creamy cleanser, or even just rinse with lukewarm water for a few days if cleansing seems to worsen irritation. When you do cleanse, use only your fingertips with the softest touch. Rinse thoroughly with lukewarm water, never hot, and pat dry gently. Consider oil cleansing if your skin tolerates it. Some irritated skins respond well to gentle oil-based cleansers that don't strip or foam. After cleansing, immediately apply soothing, barrier-repairing products to damp skin. The best ingredients for calming reactive skin include Centella asiatica, which reduces inflammation and supports healing; niacinamide at 2 to 5%, which strengthens barrier and reduces sensitivity; ceramides, cholesterol, and fatty acids to rebuild your barrier's structure; colloidal oatmeal, which soothes and reduces irritation; allantoin, which is calming and healing; and madecassoside and other calming botanical extracts. Look for products specifically formulated for sensitive or compromised skin. These typically have shorter ingredient lists with proven soothing components and no unnecessary irritants. Apply your soothing moisturizer generously. Don't skimp. Your irritated skin needs abundant hydration and barrier support. Reapply during the day if your skin feels tight or uncomfortable. Consider adding a facial oil as a final step to seal in moisture and provide extra barrier support. Oils like squalane, sunflower, or rosehip are generally well tolerated and nourishing. At night, you might apply an occlusive like petroleum jelly over your moisturizer on particularly irritated areas. This seals everything in and provides a protective barrier while your skin repairs overnight. Sun protection remains essential even for irritated skin. Choose a gentle mineral sunscreen with zinc oxide and titanium dioxide, which tend to be less irritating than chemical sunscreens. Apply it carefully over your moisturizer. Special soothing techniques. Apply cool compresses for immediate relief. Soak a soft cloth in cool water, wring out excess, and hold gently against irritated areas for 5 to 10 minutes. This reduces inflammation and provides instant comfort. Use hydrating mists throughout the day if your skin feels dry or uncomfortable. Follow immediately with moisturizer to seal in the hydration. Consider using a humidifier, especially while sleeping. Moist air helps prevent your skin from becoming further dehydrated. Avoid all potential triggers while your skin heals. Don't experiment with new products. Don't touch your face unnecessarily. Avoid very hot showers or baths. Protect your face from extreme weather, wind, cold, or intense sun. Keep everything that touches your face scrupulously clean. Use a fresh pillowcase nightly. Use a clean, soft towel each time you wash your face. Avoid makeup if possible while your skin is very irritated. If you must wear makeup, choose mineral makeup with minimal ingredients and remove it very gently in the evening. Lifestyle factors affect reactive skin significantly. Manage stress, which increases inflammation and sensitivity throughout your body. Practice calming activities. Meditation, gentle yoga, deep breathing, time in nature. Sleep adequately. Your skin repairs itself during sleep, and adequate rest supports healing and reduces inflammation. Stay hydrated internally. Drink water consistently throughout the day to support your skin's healing processes. Eat anti-inflammatory foods, fatty fish, berries, leafy greens, nuts. Avoid foods you know trigger inflammation in your body. Avoid alcohol and excessive caffeine, which can increase inflammation and dehydrate your body. Identify and avoid triggers. If certain products always irritate your skin, avoid them permanently. If seasonal changes trigger reactivity, prepare by adjusting your routine preemptively. If stress causes flares, prioritize stress management. Keep a skin diary noting what products you use, what you eat, stress levels, and how your skin responds. Patterns often emerge that help you identify specific triggers. Patch test new products before applying to your entire face, even after your skin is calmed. Apply a small amount to your inner forearm or behind your ear for several days. If no reaction occurs, try it on a small area of your face before full application. Reintroduce products slowly once your skin has calmed. After several weeks of simplified care, if your skin feels comfortable and looks healthy, you can carefully reintroduce products one at a time. Wait at least a week between additions to identify any that cause problems. Be cautious about reintroducing actives. When your skin is ready, start with the lowest concentration and use just once or twice weekly initially. Many people find they can't return to their previous frequency of active use. Their skin has shown them it needs gentler treatment going forward. When to seek professional help. If your irritation is severe, painful, or persistent despite gentle care. If you develop signs of infection, increasing pain, warmth, pus, if you suspect an allergic reaction, intense itching, hives, swelling, or if your skin isn't improving after several weeks of simplified care, consult a dermatologist. Some skin conditions like rosacea, seborrheic dermatitis, or eczema cause chronic reactivity and require professional diagnosis and treatment. Remember that healing takes time. Mildly irritated skin might calm within days. More severely compromised skin can take weeks to months to fully repair. Be patient and consistent with your gentle care. As we close, embrace this truth. Reactive skin needs gentleness above all else. Simplify drastically. Support your barrier. Remove all irritants and give your skin time to heal. Your patience and tenderness will be rewarded. May your reactive skin calm and heal. May you identify and avoid your triggers. May you treat your skin.
Antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Seasonal adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 61, Understanding Acne in Specific Sports and Athletic Activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne Treatment During Immunosuppression and Immune Compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne lesions might be higher. Aggressive acne management is particularly important.
Good morning and welcome to this gentle space. Take a moment to settle in, breathe deeply, and allow yourself to be fully present. Today we're going to explore how to build a simple, nurturing morning skincare routine that will set a beautiful tone for your entire day. Your morning skincare routine is more than just a series of steps. It's a ritual of self-care, a quiet moment before the world makes its demands, a way of saying to yourself, I matter and I deserve this care. There's something deeply grounding about beginning your day with intention, with gentle movements, with kindness toward yourself. Let's start by understanding what your morning routine is meant to accomplish. While you sleep, your skin has been working hard, regenerating, repairing, producing natural oils. When you wake, your skin doesn't need aggressive cleansing or harsh treatment. Instead, it needs gentle refreshment, hydration, and protection. Your morning routine should feel light, energizing, and prepare your skin to face the day ahead. The beautiful truth about morning skincare is that it doesn't need to be complicated or time-consuming. A simple, consistent routine is far more beneficial than an elaborate one you'll struggle to maintain. We're going to build a routine together that takes perhaps 5 to 10 minutes, a small investment of time that yields tremendous benefits. Let's begin with the first step, cleansing. In the morning, you might wonder if you really need to cleanse at all. After all, your face hasn't been exposed to makeup, pollution, or the outside world while you slept. This is a valid question, and the answer depends on your skin type and personal preference. If you have very dry or sensitive skin, you might find that simply splashing your face with lukewarm water is sufficient in the morning. This rinses away any sweat or excess oil from overnight without stripping your skin. It's gentle, quick, and effective. However, if you have oilier skin or if you applied heavier nighttime products, you may prefer a gentle cleanser in the morning. Choose something mild and hydrating, not a deep cleansing or exfoliating formula. Your morning cleanser should feel refreshing, like a gentle wake-up call for your skin, not a harsh stripping away. As you cleanse, take your time. Massage the cleanser or water onto your face with soft circular motions. Feel the temperature. Notice the sensations. This isn't just skincare. It's a mindful practice, a moment of meditation before your day begins. Rinse thoroughly with lukewarm water. Water that's too hot can strip and irritate your skin, while water that's too cold may not cleanse effectively. Lukewarm is the gentle middle ground. Pat your face dry with a clean, soft towel. Notice I said pat, not rub. Rubbing can irritate your skin and cause unnecessary friction. Gentle patting respects your skin's delicate nature. Now, while your skin is still slightly damp, we move to the next step, hydration. This is where many people incorporate a toner or essence. But let's be clear, these are optional steps. If you enjoy them and they make your skin feel good, wonderful. If not, you can move directly to your moisturizer. Skincare should enhance your life, not burden it with unnecessary steps. If you do choose to use a toner, select one that's alcohol-free and hydrating. The harsh, astringent toners of the past have given way to gentle, nourishing formulas that add a layer of hydration and prep your skin for the products that follow. Apply it with your hands or a soft cotton pad, pressing it gently into your skin. Next comes one of the most important morning steps, moisturizer. Even if you applied moisturizer before bed, your skin needs hydration again in the morning. Throughout the day, your skin will lose moisture to the environment through a process called transepidermal water loss. A morning moisturizer helps minimize this loss and keeps your skin comfortable all day long. Your morning moisturizer might be different from your nighttime one. Many people prefer something lighter in the morning, perhaps a gel or a lightweight lotion that absorbs quickly and sits well under sunscreen and makeup if you wear it. The key is finding something that feels comfortable and doesn't leave your skin feeling heavy or greasy. Apply your moisturizer while your skin is still slightly damp from cleansing or toning. This helps seal in that extra moisture. Use gentle, upward motions as you apply, covering your entire face and neck. Don't forget your neck. It's an extension of your face and deserves the same care. As you massage the moisturizer in, take a few deep breaths. Feel your shoulders relax. This is your time, your moment of peace before the day's demands begin. Now we come to the most crucial step of your entire morning routine, sunscreen. Sunscreen is non-negotiable. It's the single most important thing you can do for your skin's health, appearance, and longevity. Every dermatologist, every skin expert will tell you the same thing. Wear sunscreen every single day, rain or shine, winter or summer, indoors or out. The sun's ultraviolet rays penetrate clouds, bounce off surfaces, and even come through windows. They cause cumulative damage that leads to premature aging, dark spots, loss of elasticity, and increased skin concerns. But here's the empowering part. This damage is largely preventable with daily sun protection. Choose a broad-spectrum sunscreen with at least SPF 30. Broad spectrum means it protects against both UVA rays, which cause aging, and UVB rays, which cause burning. Apply it generously. Most people don't apply nearly enough. You need about a nickel-sized amount for your face and neck. If you find traditional sunscreen heavy or uncomfortable, explore different formulas. There are lightweight, gel-based sunscreens, tinted sunscreens that even out your skin tone, and sunscreens specifically designed for oily or acne-prone skin. The best sunscreen is the one you'll actually wear every day. Apply sunscreen as the final step in your morning skincare routine, after your moisturizer has absorbed. If you wear makeup, your sunscreen goes on before foundation. Give it a minute or two to settle into your skin before applying anything else. Let's pause here and review what we've covered. Gentle cleansing, hydrating toner if desired, lightweight moisturizer, and thorough sun protection. These 4 simple steps form a complete, effective morning skincare routine. But skincare exists within the larger context of your life. Let's talk about how to enhance your routine's effectiveness through complementary morning habits. Start by thinking about your sleep. The quality of your sleep directly impacts how your skin looks and functions in the morning. If you're consistently getting poor sleep, no skincare routine can fully compensate. Prioritizing 7 to 9 hours of quality sleep is one of the most powerful things you can do for your skin. Your pillowcase matters more than you might think. If possible, sleep on a clean pillowcase, preferably made of silk or a smooth cotton. Rough fabrics can create friction against your skin, and pillowcases harbor oil, bacteria, and dead skin cells. Changing your pillowcase twice a week, or even more frequently if you're acne-prone, is a simple habit that supports skin health. Hydration from within amplifies your morning skincare. When you wake up, drink a glass of water. Your body has gone hours without hydration, and replenishing it helps every system function better, including your skin. You don't need to force excessive amounts, just a mindful glass of water as part of your morning ritual. Consider the environment in your bedroom. If the air is very dry, especially in winter or in air-conditioned spaces, a humidifier can help prevent your skin from becoming dehydrated overnight. This means you'll wake up with more comfortable, balanced skin. Your morning routine should also adapt to your life circumstances. If you exercise in the morning, you might cleanse before your workout with just water, then do your full routine afterward when you shower. If you're rushing, it's better to do a simplified version of your routine than to skip it entirely. Sunscreen and moisturizer are your non-negotiables. If you only have 2 minutes, prioritize those. As seasons change, your morning routine might need small adjustments. In summer, you might prefer an even lighter moisturizer, or might add an antioxidant serum under your sunscreen for extra protection. In winter, you might need a slightly richer moisturizer to combat dry air and indoor heating. Listen to your skin each morning. Does it feel tight? It might need more hydration. Does it feel oily? Perhaps you can use less moisturizer or skip the toner. Your skin communicates with you. You just need to pay attention and respond with gentle adjustments. One more important aspect: give yourself grace. There will be mornings when you're running late, when you're exhausted, when you simply can't manage every step. That's okay. Do what you can and release any guilt. Consistency over perfection is what creates lasting results. Missing one morning doesn't undo all your efforts. Your morning skincare routine is also an opportunity to set an intention for your day. As you care for your skin, you might silently affirm something positive. I am taking care of myself, or I am worthy of this time and attention, or simply, I am here, present in this moment. These quiet affirmations, paired with the physical act of self-care, can shift your entire mindset. As we conclude, let's return to simplicity. Your morning routine should feel like a gift, not a burden. It should energize you, not exhaust you. It should take just a few minutes, but those minutes should feel intentional and nourishing. Cleanse gently, hydrate thoroughly, protect consistently. These are the pillars of your morning skincare ritual. And remember, the most expensive products, the trendiest ingredients, the most elaborate routines, none of these matter as much as consistency, gentleness, and patience. Welcome to this compassionate space. Breathe slowly and deeply, centering yourself in calm. Today we're talking about hormonal acne and how to deal with it gently, a topic that affects many people and requires understanding, patience, and a multifaceted approach. Hormonal acne is acne driven primarily by hormonal fluctuations. It typically appears along the jawline, chin, and lower cheeks, though it can occur anywhere. It often flares in predictable patterns: before menstruation, during pregnancy, postpartum, during perimenopause, or when starting or stopping hormonal birth control. Understanding the hormonal connection helps you approach this type of acne with realistic expectations. Hormones, particularly androgens, increase sebum production and can cause inflammation in skin. When these hormones fluctuate, acne often follows. This is biological, not a failure of your skincare routine. Hormonal acne requires patience because topical treatments alone often aren't sufficient. You're addressing an internal trigger manifesting externally. Both internal and external approaches work best in combination. Let's start with topical care for hormonal acne. The basics remain essential: gentle cleansing, appropriate treatment, moisturization, and sun protection. Use a mild cleanser once daily in the evening. Avoid harsh stripping products that damage your barrier and make skin more reactive. For treatment, several ingredients help hormonal acne. Salicylic acid penetrates pores and reduces oil buildup. Use 0.52% concentration 3-4 times weekly. Benzoyl peroxide kills bacteria that worsen acne. Use 2.5% concentration as needed on breakout-prone areas. Retinoids are particularly effective for hormonal acne. They regulate cell turnover, unclog pores, and reduce inflammation. Over-the-counter adapalene or prescription tretinoin use 3-4 times weekly or as tolerated can significantly improve hormonal breakouts. Be patient. Retinoids take 3 to 6 months to show full effects. Niacinamide at 5% helps regulate oil, reduce inflammation, and support barrier function. It can be used twice daily and is gentle enough for sensitive skin. Azelaic acid has both antibacterial and anti-inflammatory properties. A product with 10 to 20% azelaic acid can help manage hormonal breakouts. Apply treatments consistently, but always follow with moisturizer. Hormonal acne doesn't mean you should skip hydration. Healthy barrier function supports clearer skin. Now let's discuss internal approaches. For many people with hormonal acne, topical treatments alone aren't enough because the trigger is internal. Hormonal birth control is one option for managing hormonal acne in women. Certain oral contraceptives that contain estrogen and progestin can regulate hormones and significantly reduce acne. This requires a prescription and discussion with a healthcare provider about whether it's appropriate for you. Benefits can include clearer skin, but there are potential side effects to consider. Spironolactone is an anti-androgen medication that blocks the effects of testosterone on skin, reducing oil production and acne. It's used off-label for hormonal acne in women and can be very effective. This requires a prescription and monitoring by a healthcare provider. It's not suitable for everyone. Pregnant women or those planning pregnancy cannot use it. For severe or cystic hormonal acne, a dermatologist might recommend isotretinoin. This powerful medication can permanently change how your skin produces oil. It requires careful monitoring due to significant side effects, but can be life-changing for severe cases. Supplements that some people find helpful include evening primrose oil, which may help regulate hormones, spearmint tea, which some studies suggest may reduce androgens, omega-3 fatty acids, which reduce inflammation, and DEM, diindolylmethane, which may support estrogen metabolism. Always consult a healthcare provider before starting supplements. Lifestyle factors significantly affect hormonal acne. Manage stress, which increases cortisol and can worsen hormonal imbalances. Practice stress reduction techniques regularly. Meditation, yoga, deep breathing, time in nature, creative expression. Sleep adequately and consistently. Sleep disruption affects hormones significantly, including those that influence skin. Exercise regularly, which helps balance hormones naturally. But cleanse promptly after sweating to prevent additional breakouts. Evaluate your diet. Some people find that dairy worsens hormonal acne due to hormones naturally present in milk. High glycemic foods may increase insulin and affect hormones. Consider eliminating these for a month to see if your skin improves. Eat foods that support hormonal balance. Cruciferous vegetables like broccoli and cauliflower support estrogen metabolism. Foods rich in zinc support skin health and hormone balance. Probiotic-rich foods support gut health, which affects hormones. Anti-inflammatory foods reduce overall inflammation. Stay hydrated to support all bodily functions, including hormone regulation. Track your cycle if you menstruate. Notice when breakouts typically occur. This helps you anticipate flares and adjust your skincare accordingly. You might use more targeted treatments during the week before your period when you know breakouts are likely. Be extra gentle with your skin during hormonal flare periods. Don't over-treat or use harsh products in frustration. Gentle consistency works better than aggressive intervention. Address underlying conditions if present. PCOS, polycystic ovary syndrome, often causes hormonal acne. If you have other symptoms, irregular periods, excess hair growth, weight gain, consult a healthcare provider about possible PCOS. Treating the underlying condition helps clear the acne. Thyroid disorders can also affect skin and hormone balance. If you have symptoms beyond acne, get your thyroid checked. Don't pick or squeeze hormonal breakouts, which are often deeper and more inflamed than other acne. Picking causes scarring and worsens inflammation. Keep everything that touches your face clean. Change pillowcases frequently, clean your phone, wash makeup brushes regularly. Be patient with treatment. Hormonal acne takes time to improve. Topical treatments need 6 to 12 weeks to show results. Hormonal treatments like birth control or spironolactone can take 3 to 6 months to demonstrate full effects. This timeline is frustrating but normal. Don't expect your skin to be perfect every day of your cycle. Some fluctuation is natural and normal. You're aiming for overall improvement, not complete elimination of every breakout. Seek professional help when needed. If hormonal acne is severe, causing scarring, not responding to home care, or significantly affecting your quality of life, consult a dermatologist. They can prescribe stronger treatments and work with you to find an effective approach. Consider seeing an endocrinologist if you suspect significant hormonal imbalances beyond just acne. As we close, remember that hormonal acne is complex and often requires both internal and external approaches. Be patient with the process, gentle with your skin, and compassionate with yourself. This is a biological issue, not a personal failing. May your hormonal acne improve with time and proper care. May you find effective treatments. May you have patience for the healing journey. Thank you for this time together. Manage your hormonal acne gently and compassionately. Welcome to this gentle healing space. Take a slow, calming breath. Today we're exploring how to reduce acne marks over time, those stubborn spots that remain after breakouts heal. With patience and gentle care, these marks can fade significantly. Acne marks, also called post-inflammatory hyperpigmentation or PIH, are dark spots left behind after acne heals. They're not scars. They're areas where inflammation triggered excess melanin production. The good news is that these marks are temporary and will fade on their own, though you can support and accelerate this process. Understanding the difference between marks and scars is important. Acne marks are flat discolorations, brown, red, or purple, depending on your skin tone. Acne scars involve textural changes, indentations, raised areas, or tissue damage. Marks fade with time and proper care. Scars typically require professional treatment. Today we're focusing on marks. The most important step in reducing acne marks is preventing new ones. This means treating active acne gently to minimize inflammation, never picking or squeezing pimples, which increases inflammation and darkening, and protecting your skin from sun exposure, which darkens marks significantly. Sun protection is absolutely crucial for fading acne marks. UV exposure triggers melanin production, making marks darker and slowing fading dramatically. Wear broad-spectrum SPF 30 or higher every single day, even when indoors or when it's cloudy. Reapply if you're outside for extended periods. Without consistent sun protection, other treatments will be far less effective. Now let's discuss treatments that support mark fading. Several ingredients have been proven to help fade hyperpigmentation safely and effectively. Vitamin C is a powerful antioxidant that inhibits melanin production and brightens skin. Use a serum with 10–20% L-ascorbic acid, the most effective form. Apply it in the morning under moisturizer and sunscreen for antioxidant protection throughout the day. Be patient. Vitamin C takes several weeks to show visible results. Niacinamide reduces inflammation, which prevents marks from forming and helps fade existing marks by inhibiting melanin transfer. A serum or moisturizer with 5–10% niacinamide can be used twice daily and works well with other ingredients. Alpha hydroxy acids like glycolic or lactic acid exfoliate surface layers, encouraging cell turnover that gradually removes pigmented cells. Start with 5–8% concentration 2 or 3 times weekly. As your skin builds tolerance, you can increase frequency. Always use AHAs in the evening and be diligent with sun protection the next day. Azelaic acid addresses both active acne and marks simultaneously. It has antibacterial properties and inhibits melanin production. A treatment with 10–20% azelaic acid can be used once or twice daily. Retinoids accelerate cell turnover, bringing fresher, less pigmented cells to the surface while preventing new pigmentation. Over-the-counter adapalene or prescription tretinoin used consistently over months significantly fades marks. Start slowly, 2 to 3 times weekly, and build tolerance. Always use retinoids at night with thorough sun protection the next day. Kojic acid, licorice root extract, and arbutin are natural ingredients that inhibit melanin production. Look for serums containing these ingredients. They're gentle and can be used daily. Tranexamic acid is a newer ingredient showing promise for fading hyperpigmentation. Products with 2 to 5% tranexamic acid can be incorporated into your routine. Layer these ingredients thoughtfully. A common effective routine: morning, vitamin C serum, niacinamide moisturizer, sunscreen; evening, cleanser, AHA or retinoid, niacinamide moisturizer. Don't use all actives at once. Choose 2 to 3 that work for your skin and use them consistently. Rotation works well. AHA one night, retinoid the next. Rest day, repeat. Be patient. Acne marks take time to fade. Typically 3 to 6 months for significant improvement, sometimes up to a year for complete fading. Consistency matters more than intensity. Gentle, regular use of effective ingredients will fade marks over time. Professional treatments can accelerate fading if home care isn't sufficient. Chemical peels performed by professionals provide deeper exfoliation. Microneedling stimulates collagen production and can help fade marks. Laser treatments target pigmentation specifically, but can be expensive and require downtime. Discuss these options with a dermatologist if you're interested. Professional treatments combined with good home care give the best results. Lifestyle factors affect mark fading. Manage inflammation by reducing stress, getting adequate sleep, eating anti-inflammatory foods, and staying hydrated. Less inflammation during healing means less dark marking. Be extremely gentle with active breakouts. Never pick or squeeze. This dramatically increases inflammation and resultant dark marks. If a pimple needs draining, use clean tools, minimal pressure, and immediately apply spot treatment. Keep your skin well moisturized. Healthy, hydrated skin repairs and renews itself more effectively than dry, compromised skin. Certain skin tones are more prone to post-inflammatory hyperpigmentation, particularly darker skin tones with more melanin. If you have darker skin, be especially vigilant about sun protection and gentle acne treatment. The principles are the same, but the importance is amplified. Avoid harsh treatments that could cause more inflammation and thus more marks. Be cautious with strong peels, aggressive exfoliation, or irritating ingredients. Gentle, consistent care works better than aggressive treatment for fading marks. Understand that complete fading takes time measured in months, not days or weeks. Set realistic expectations. Significant lightening in 3 to 6 months is success. Don't expect miraculous overnight results. They don't exist. Take photos monthly to track progress. Day-to-day changes are imperceptible, but monthly comparisons show the gradual fading occurring. Stay consistent even when progress feels slow. The treatments work cumulatively. Every day of gentle care, sun protection, and appropriate treatments is contributing to fading, even when you can't see immediate results. As we close, remember, acne marks are temporary. With patience, protection, and gentle encouragement through effective ingredients,